That just went up here not long ago, so you're right.
So it's
that don't make a lot of sense.
It's not. It's nonsense.
Well, again, you know, I guess what bothers me more than anything else is that if there's such a mix-up on all these rates that they're talking about and everything else, and you look at the impact of the items that you talked about, we're going from bad to worse. Yeah. And the hospitals are you know, right now, and just not getting off the subject that much, hospitals, especially not-for-profit hospitals like we are really subjected to taking a lot of non-paying patients in, whether they're
so
trauma,
what? You have to.
Yeah, or anything else. We take a lot of men, and once they come in, we can't refuse them. We got to give them treatment.
That's right.
And so it's kind of a double-edged sword here, you know, because I don't know what our cost is now, but I know it was significant through this. And what we don't want to do is put more burden on people. There's already enough burden on them now. And then you got a health plan that's the federal health plan. Yeah. We don't know what the hell the impact of that's going to be. Yeah. So, and that also, from a hospital standpoint, we looked at that also, and when they did the study on that one, it's going to cost the hospital millions of dollars a new plan.
Yeah, that's right. I think another key point, though, too, that you talked about the profit margins that insurance companies make. I mean, hospitals are not huge profit machines.
No.
The best.
We're lucky if we can make 2%.
I know.
All right?
The best performing hospitals in the country may be 3 to 5%. Most hospitals, a majority of them in the last few years, have lost money. So a couple % profit margin is about the norm or the average of what you see. So it's not like we're out there generating.
You're just keeping your head above water.
That's exactly right.
That's right. And this is going to cost the hospital, I don't know how many jobs at your particular facility, but I was recently with Brooks Patterson in Oakland County, and they conservatively estimated it would kill 10, 11,000 jobs immediately. I mean, for what? We have, you know, in all of America, there's 300 top of the food chain CARF accredited rehabilitation facilities. We have 150 of those in Michigan. We finally got the Pentagon to look at us as a great resource to help our veterans to recover from brain injuries. This is the #1 growth category for Michigan for the next 20 years. Excuse me, healthcare. So why would we do anything that jeopardizes the thing that we need the most in Michigan, which is jobs, jobs, jobs? We have to protect the jobs. We can turn this into a cornucopia of great resource for the entire world by getting the word out about our resources and create hundreds of thousands of jobs over the next 10 years here in Michigan. But we need to start with protecting and preserving this no-fault statute that's worked so well for 38 years.
I mean, goodness gracious. I mean, it's been the model for anybody else that's out there that's in other countries or cities and states that are trying to do these things. But why would, I guess I always say, why do you tamper with something that's working?
If it ain't broke, don't fix it.
Exactly. And I mean, here we got a plan here that's not broke, it's working well, and it's doing everything, but along comes the insurance industry and says, hey, you know,
it's a greedy grab, Ted. And again, citizens can go to dothemathmi.org and get all the information drilled down. The Coalition Protecting Auto No Fault is made up of the Hospital Association and the rehabilitation centers and the home care companies. There's 30 different associations that make up this coalition. And the hundreds of thousands of jobs that are contained there, everybody is saying, whoa, slow the horse down. Let's not have a race to the finish line. Let's take a look and let's get transparency on all of these assertions. It's very interesting when somebody comes and says, oh, here's a big problem, but we're not going to tell you the basis for our assertion. And it's just wrong. At the end of the day, the money is put there by the people. It's for the people, and it serves the people if they have to go to the hospital and get trauma care. It serves the people if they're in intensive care, if they need brain injury rehabilitation, if they want to be taken care of at home. And that's the beauty of the model. You mentioned other states. Florida would like to adopt our model. The same insurance companies that operate in Michigan are selling a no-fault policy in Florida for $250 more on average than Michigan's cost. And here's the kicker. they only offer $10,000 worth of medical benefits.
Jeez.
$10,000. So those poor souls go bankrupt. And the governor said to me, how could that be? And I said, because you guys don't know this. And that's why I have been trying for the last 5 years to export the beautiful concept that Michigan manifested 38 years ago for the benefit of these other citizens around the country that are suffering. The Hospital Association in Florida was just absolutely floored when they understood that, oh my goodness, there would actually be this resource so we could hire more people, so we could give quality care to people. So I think that's the lens that citizens need to look at it through. It means nothing. This happens to about 1/2% of our citizens. About 4 people a day have this problem in Michigan. The people that survive because they get quality care, their care persists often for decades. But it matters to those people instantly. So what we ask people to do is imagine, what if it was you? What if you had a brain injury or a loved one had a spinal cord injury? What would you want? Would you want this incredible resource that you funded, or would you want to worry about insurance companies making more profit? That's really what it comes down to.
And like I say, it took us a long time to get this trauma center. We're the only trauma center in this area, and
that's a life and death issue. I mean, if you didn't have the trauma center, you're not going to survive.
No, and we've, and it's already been proven in some of the things that they've done already.
Absolutely.
In terms of saving lives, and these guys are the top specialists that you have in the trauma centers.
Absolutely, they're the best people in the business.
You got your best people forward up there, yeah, and they're there 24 hours.
Yep.
So it just doesn't make any sense to me that we fought all this time and finally got a trauma center going to better serve the people who have those type of injuries, auto injuries, all the different injuries that happen, and now we're trying to dilute the thing. I mean, something isn't making sense here.
Well, I think a lot of legislators are catching on to your point of view, Ted. The fact that the mantra has been for the last couple of weeks, prior to the Thanksgiving break, and certainly this week, show us the evidence that there's a problem. I mean, it's kind of, it's arrogant to say you couldn't understand, which is what Kevin said. If he gave you the information, Kevin Clinton, our insurance commissioner, that you couldn't understand it, I find that very difficult to believe.
So he's the only genius out there.
Well, I mean, it's an incredible assertion.
Yeah.
There's a lot of very intelligent people that are in healthcare serving the needs of people that are sick, and I'm certain all of them, Mr. Damon and everybody else in the hospital group, myself, anybody, you. I mean, you're the treasurer of Macomb County. Certainly you could understand exactly what the implications are if you saw the finances.
Absolutely. But when we look at the hospitals today, I mean, we have to have all up-to-date modern equipment in there. I mean, the state-of-the-art stuff to make sure that patients who come in are going to get the best possible care, which is not cheap, as you know, as our chief financial officer. You know what we spend. Hospitals have been somewhat diluted in terms of revenue, because many doctors' offices and many of these guys do a lot of the testing there that they used to do at the hospital. I mean, a lot of doctors do cardiograms, they do this, they do that. They'll do it all in offices. They don't come to the hospital anymore. Now, those are low-risk
procedures.
Yeah. And what the hospitals get is all the high-risk, the more technical type. So our costs go like this.
That's right.
So
I'm certain Mr. Damon can testify to the fact that right now in Washington, the committee of 12 was talking about reducing Medicaid. I mean, that's going to happen. It didn't happen now, but it's going to happen. And then what does that mean for the hospital? If you have to take patients and you have to serve them at a 50% loss, and now they're going to cut the contribution to the state, that's going to create just a nightmare for our state when that happens, which is another reason why we can't push citizens over the cliff onto Medicaid by killing this industry. It's a terrible idea. It's probably the worst public policy proposal that I've seen in the last 30 years.
Well, I'll tell you this much: it's got every hospital in Michigan deeply concerned about this thing and what the impact is going to be on the hospitals.
Yeah. Absolutely.
And certainly, and that's why we're here today, is to try to get a message out to people to understand what this is all about. Somebody says, "Oh, well, we got a House Bill 4936." Well, what's that?
Right.
I mean, the average guy's not no. So the red flag has to go up and say, "Look, here's what's at risk."
That's right.
You know, and I'm glad you're here because of your background, that you're able with him to at least get this message out so people understand what's at risk here.
Well, you know, after someone gets in an accident and they're airlifted or they're taken by ambulance to the hospital and they get good care and they're stabilized, it's not uncommon for our clients. We do the home care after they leave the hospital. But I mean, for our clients, many of whom are on ventilators because they're brain injured and they're spinal cord injured, they've been in ICU oftentimes for 60 days, and then they're going to go to a subacute rehabilitation center after they're stabilized, but now they want to go home and be around familiar sights and sounds and smells. And that's where our nurses at Health Partners Home Care, where we specialize in serving that population, our nurses come and take care of those people 24 hours a day, 7 days a week. So here's the question. If you were that person or it was your loved one, what would you rather have? The ability to do that, or would you want to be sent to a long-term care facility where you're essentially warehoused because you're going to be on Medicaid, and those facilities can't afford to have the patient care ratio of 1-to-1. They'll have a nurse that takes care of 15 people. So the question is, what would you rather have? And again, we're encouraging citizens to get educated on the topic, just like you recommend. Go to the website, dothemath.mi.org, and then call your legislators, call your representative, call your senator, and say, you know, I really hope you vote no on this, and in the very least, ask the insurance companies for evidence of their assertion that this is unsustainable. All of us in the association, the coalition, know that it's sustainable. I mean, how could it be unsustainable when it's worked for 38 years? This recent year, June 30th, year ending, we netted $650 million on our investment income alone. Okay, after expenses, which were around $811 million, and the contributions they took in from drivers, we rolled that $450 million into the fund. There's no other system like this on the planet. So it's a very deceptive proposal by the insurance industry that really only wants to make more profits. And you know, another important thing, if they were to kill the lifetime medical benefits component, well, then everybody in Michigan is going to have to buy more liability coverage to cover the potential that you're the at-fault driver that hurts somebody, because you're going to get sued for $10, $15, $20 million. All of a sudden, they say, the insurance companies say this is going to save money. It's going to cost you thousands more to buy additional liability coverage.
And they're the ones that make out. Well, we got to wrap this thing up, and John, I want to really thank you, and I'm going to get. Hopefully you'll come back and do another show.
I'd love to. Thank you. This is my passion.
Also, Damon, I know that you, as the financial guy, understand all the implications and the impact on hospitals.
Yeah.
So we need to make sure the public fully understands what's at risk here, and there's a whole lot at risk, and there's a whole lot at risk for the hospitals. So I want to thank you both for coming on the show, and we're going to get you back to do an update on this thing.
Thank you very much.
And again, thank you.